The member from Oshawa. For the
Thank you very much, Speaker, and I'm glad to be able to weigh in on this budget debate for the budget 2023, which is indeed disappointing for a lot of folks across communities, and I'm pleased to share some of their voices in this space because many of them were not heard. And Speaker, I will say that it has been a disturbing trend for quite some time that many community groups and agencies and voices are kind of directed to a different door when it comes to presenting to this government. The Finance Committee, as we know, is a multi-party committee that travels across Ontario, arguably not enough, but however, they travel to communities and hear from folks. But then there's this side process where the Minister of Finance and government MPPs invites folks to this community chat, community consultation, where agencies might get 3 minutes each to share with the minister. And then people think, after they've done that they've spoken to the Minister of Finance and to various local MPPs, then they think that they've made a presentation on the budget. What they don't realize is there's no record of that is public, whereas if they present to the Finance Committee, there's a record that the opposition parties have a chance to hear, have a chance to ask questions. There's Hansard. Thank you to the folks who travel with committee and keep track of the voices. But these folks are directed to that side door that says, hey, come and present on the budget. So disappointingly, there are a number of our community agencies in Durham who have been rerouted, and their voices did not make it into the committee hearings. And so I wanted to share a few of those folks. But I just wanted to say, Speaker, I think that is really problematic. Now, I will say it's always important. If you get a chance to talk to the minister face-to-face, you take it. But in addition to that, there is an accountable process that folks have been rooted away from, and that is well, I think it's a bit dirty, but anyway, it isn't how this place should work. Speaker, some of the things that are missing from this budget are important to the folks in Durham Region. And there are 7 members of this legislature who represent at least part of Durham Region, 7 of us. I am the only non-government member, so my office is busy hearing from people who have concerns when it comes to government priorities. I would like to share that something that was missing from this budget was funding to get the wheels turning for a new Lake Ridge Hospital. I want to read here from the Durham Business Alliance, which, as they say, represents the 8 chambers of commerce and boards of trade Durham Region and a combined membership of approximately 2,500 local businesses or organizations. They have said, quote, "We are following up on our previous letter today to express our deep disappointment in the recent budget announcement, which made no provision for funding a planning grant for a new regional hospital and trauma centre for Lake Ridge Health in Durham Region. We believe the lack of funding for a new hospital is a major oversight in this budget. Durham Region, with its growing population, is in dire need of additional hospitals." And they list the various reasons. They've said, quote, "A new hospital for Lake Ridge Health would not only address the issue of aging infrastructure, but also provide much-needed capacity to serve the growing population of Durham Region. Lake Ridge Health is ready to meet these demands. We urge the government to recognize Lake Ridge Health's recommendation and reconsider its decision and allocate funding for a planning grant for the new hospital in Durham Region." And they've said no later than the fall economic statement. Of course, I support that, Speaker. And as I said, there are 7 of us in this chamber who are hearing the need is great, and to not see it reflected in the budget is too bad. But there is a chance for this government to course correct. Speaker, we've also been talking about mental health and health care in this House. I wish, though, that we were seeing more funds directed to places that would make a difference. Here I have a submission from Ontario Shores Centre for Mental Health Services, or Mental Health Sciences, affectionately known as Ontario Shores. And they have said, despite the urgent need, Ontario Shores does not currently have an emergency department to provide the necessary acute mental health care to Ontarians in need. We are requesting funding and approval from the Government of Ontario to build and construct Canada's first Emergency Psychiatric Assessment, Treatment and Healing Unit, or EMPATH for short. EMPATH is a psychiatric emergency care model that is transforming mental health care in the United States. We require a $1 million capital planning grant and approval of our Stage 2 submission with the Ministry of Health. They go on to explain how this model sets itself apart from others and would make an unbelievable, immeasurable difference in our community, but beyond our community, in the province. It says the benefits of an empath emergency department at Ontario Shores would have wider implications for Ontario's health system. A model like this at Ontario Shores would reduce the strain on the province's emergency rooms, allow for better, more specialized care for people in mental health crises, and free up resources for other emergency services. As one of only 4 provincially specialized mental health hospitals in Ontario, we are uniquely positioned to introduce this concept to Canada and are requesting a capital planning grant for this project as part of the upcoming Ontario budget. Speaker, they go on to say they have support from the Durham MPPs, mayors of Oshawa, Whitby, Pickering, the Durham Regional Chair, healthcare professionals, staff and people in the wider community supporting their vision of transforming mental health care in the province. Partners such as Durham Regional Police Service and Region of Durham Paramedic Services have endorsed this project. They've garnered over 8,000 signatures of Ontarians who want to see this first empath emergency department built at Ontario Shores. But alas, it was not in the budget. I would love to know why. If mental health is actually a priority for this government, here is a really big opportunity, and this would be a significant ribbon to cut for this government, but more importantly, would have remarkable impacts on people in need. Speaker, I also wanted to raise the topic of hospice. I had actually a quick chat with Joyce Marshall in our community the other day at a community event, and she was very excited to be an ambassador for the Whitby, for Hospice Whitby, and they have decided on a name and unveiled that, the Hospice Whitby Roger Anderson House. A lot of community care and interest and involvement in this project. But Whitby and Clarington hospice folks are asking for money. And I know that they asked at these community consultations I was telling you about, that was a side process to the budget hearing that they did not actually get to present to the Finance Committee because they didn't know that they hadn't. They thought that this community consultation was sufficient. Hopefully it was, and yet the money isn't in this budget. I hope that the $2 or $2.5 million each that they are asking for is something that this government can figure out, because what hospice would mean and those beds and that care for the community of Durham, as we've seen the Port Perry is a good news story, the hospice there. As someone who has seen hospice up close and personally when my mother passed, and I know how important it can be, and I know how, frankly, how beautiful the pieces that they add to a very challenging time for families can be. I do believe that this is it should be a priority from this government or any government. Speaker, I want to go on to also share how challenging it is for folks. I got a letter from someone named Jennifer in Owen Sound, and she had seen remarks that I made in this legislature and said, as you are aware, life on ODSP is hard, but the real nightmare is living with the knowledge that life will only get harder. A few years ago, my fridge broke, so now I use my 12-year-old freezer and a cooler. My shoes are coming apart, so I hot glue them back together. My electric kettle can take anywhere from 5 to 15 minutes as it shuts off repeatedly before the water boils. But I wait for the day the freezer breaks down, when my shoes are too bad to be glued and the kettle doesn't boil at all. And that day is coming. I appreciate that you see myself and others like me as persons who are doing all they can and wish every day that we could do better. But the fact that we can't shouldn't mean we live every day with the terror of a hard life becoming an unbearable one. Thank you for fighting for us to live without this fear, wrote Jennifer from Owen Sound. Speaker, people are hurting, as we have talked about with food banks, and I have a really thoughtful letter from Ben Earl, the Executive Director of Feed the Need in Durham, who laid out recently in the paper for us about more clients than ever before who are fully employed, who own their own homes, and who would have historically been able to meet the demands of their household budgets. That is no longer the case. Speaker, there is need in this province not being met. Thank you.
Questions? The member from Whitby.
Thank you, Speaker, and through you, this budget, the budget bill that we're talking about today, included $13.4 million as part of the guns, gangs, and violence reduction strategy. Member for Oshawa will know well the level of investment historically that this government has taken, including this new money that will be going into the good work that the Durham Regional Police Service will be doing with this funding. Does the member from Oshawa agree that this level of funding for guns, gangs, and violence reduction strategy will continue to have the level of effectiveness in the region of Durham that we've known for the last 8 years? Thank you.
Response, the member from Oshawa.
Thank you, and I appreciate the question from the member from Whitby. Of course, we share Durham Region and are grateful for any measures that keep us safe, but I also wanted to kind of respond back with what I have heard from victim services about the needs. So those impacted by violence, their needs are not being met. Victim services core funding across the province, they have not had reasonable core funding increases in years, and the funding formula is not tied to the numbers of clients. So they're still receiving the same amount of funding today to serve 10,000 clients in our region than they were when they were serving only 3,200. And when we talk to the folks who do that unbelievable work for victim services, they are bringing real solutions to the table that I would ask this government to consider how we retain that staff to do that unbelievable caring work when they are paid, $37,000 yearly. The burnout and turnover is astronomical, and this is a government that is choosing to let that happen. Thank you.
Further question? The member from Waterloo.
Thank you very much, and thanks to the member from Oshawa for really addressing the issue of hospice care and the desperate need for addressing the funding formula and making it more fair and actually meeting the operational costs of hospices across the province. We heard at Finance Committee that every dollar invested in compassionate palliative care really also saves the healthcare system so much money. But I think when she commented on her own mother and sharing that experience with all of us, it's very personal. We know this to be very true, that dying in Ontario can be a really horrendous experience if you're not supported and you don't get the counselling that you need, the grief counselling. And so I wanted her to address, please, the fact that hospices are only funded 60% of operational costs. And how does that impact equity of access to those services across Ontario?
Response, member from Oshawa.
Thank you. It's frustrating to hear from the folks who are doing the heavy lifting of the fundraising and trying to get the word out to communities about the benefits of hospice. I have here from some speaking remarks from Eva Reddy, the Durham Region Hospice Board Chair. She had presented to Council in Ajax and talked about the future of the 10-bed hospice residence in Whitby, which is one of 3 locations approved by the Ministry of Health. And she outlined the challenges that their original tender process in January, well, the project came in approximately $3.5 million more than originally estimated, which is a reflection on kind of the broader world, the current construction situation since the pandemic. And so it's back to the drawing board. It's back to the door knocking. It's back to the fundraising. And they're plugging away. But to know that they had the government supporting them in a very real way that would bring this care and benefit into the community, into more communities, what a difference that would make in Ontario. Thank you.
Further question, the member from Richmond Hill.
Thank you, Madam Chair. Madam Speaker, I just want to say that Ontario has been successful in attracting manufacturers, and we are promoting the products that are manufactured in Ontario. So we need a lot of skilled workers. I would like to ask a question. Will the opposition support the proposed investment of $25 million in Ontario Immigrant Nomination Program so that Ontario can welcome more newcomers and will have the skilled labourers to help build Ontario?
Response, member from Oshawa.
Well, if we were able to pull certain things out of the budget to vote on one at a time, there are some highlights and positives in this budget, and what the member just raised. It is immensely important to recognize the skills coming to the province, to ensure that there is economic opportunity, fairness for more folks, and I know that we would all hopefully would work as partners in that regard. And when it comes to economic opportunity in communities, I live in Oshawa, right? And we have wonderful opportunity now in the automotive sector that I hope we get to keep, right? It wasn't that long ago that I stood here and it was all on the brink.
Response?
So jobs in community, giving people opportunity, that is part of why I am here, and hopefully that is something we all can get behind. Thank you.
Further questions? Oh, sorry, the member from Nickel Belt.
Thank you, Speaker. I truly appreciated the story that you shared from your constituents who is on ODSP with a kettle that doesn't work, with shoes that she needs to glue back together in order to be able to have decent shoes, with the different problem directly linked to poverty. We all know that poverty is the #1 determinant of health. For every $5,000 more you make a year, we can see the improvement on the health of each and every one of us. Could you share with us how much money is there in the budget to help your constituents on ODSP receive enough money so that she can live a healthy life? How much money is in the budget so that she receives enough money to be out of poverty?
Response, the member from Oshawa.
Not enough. And actually, the letter that I shared was from someone who was just watching what we do here and was from Owen Sound. It wasn't a constituent of mine, but could be any of our constituents. When you talk about the impacts of poverty when it comes to health, I want to read from a letter here, a family physician who had said, he's written a prescription about a patient. He said this man, his patient, has requested this letter of support regarding income security programs. He's currently receiving benefits under the Ontario Disability Support Program. With the rising cost of housing, rent, energy, utilities, food, etc., he and others on ODSP are struggling to maintain good health. These individuals invariably reside in small, congregated, or at times poorly maintained housing units, which can have a negative effect on their mental and physical health. Spending most of their monthly benefit on rent leaves limited funds for proper nutrition and recreational activities. A poor, nutritionally depleted diet is a risk factor for many chronic diseases, leading to increased morbidity and mortality and subsequent increased cost to the healthcare system. His doctor is writing doctor's notes about how bad it is for patients in poverty.
Question? The member from Essex.
Thank you, Madam Speaker. I come from the Essex region, and in Essex region, we used to have General Motors, but as a result of the automotive lack of policies from the Liberal government, General Motors left the Essex region. The member from Oshawa was speaking, and the member from Oshawa is very fortunate because not only is General Motors still in Oshawa, but based on the remarkable economic governance of the province by this PC government, Oshawa has now committed an additional $2 billion, or General Motors has committed an additional $2 billion to Oshawa and Ingersoll in automotive investments. That's $2 billion more. Will the member vote in favour of keeping automotive investment in Oshawa based on this government's policies?
Member from Oshawa.
I live in Oshawa, where we have a long history of automotive excellence, and we will have a long future thanks to the workers, the product that they put out. Silverado sales are up. That's great. This is a government, though, that I stood here opposite them when we were in crisis and had to listen to the ship has left the dock and that there was no point in hope, that I was peddling false hope, and I was glad to stand with the community at that time, and I always will. This is a government that ripped out charging stations when the automotive industry was saying the future is electric. Well, it is electric. In fact, the Premier did a fun little dance the other day, finally has acknowledged that. So I look forward to working towards the infrastructure that will support that industry in our community and across the province. Thank you.